Good morning. My name is Matt Constantine, the Director of Kern County Public Health. Today is November 19th, and I appreciate everybody joining us for our Kern County COVID-19 update. I have a few words that I'm going to say, and then I'm going to turn it over to Ryan Alsop. This morning we are announcing 309 new cases in Kern County, and fortunately no additional deaths. The state has come out with their monitoring metrics as we await every week. This week, because of the increasing cases statewide, the state has made some changes. They first off released the data on Monday instead of Tuesday. So on Monday, the state released information to indicate that our case rate, that's the number of cases over a 7-day period, was 16.1. That's high. Our adjusted case rate is 17.9. Our testing positivity rate is at 8.0%, and our testing positivity in our health equity metrics in those census tracts that the state has asked us to focus in on is at 8.4. All of those numbers are have increased from the week prior, and clearly demonstrates that California is seeing increases, and then Kern County obviously is seeing some increases in cases too. Also, the state indicated that our testing rate has increased. This is the number of tests averaged over 7 days per day per 100,000. So that's 234 tests that we're conducting per 100,000 on a daily basis. That number is up significantly. We're very appreciative that the public has responded, that the testing sites remain accessible and available. Unfortunately, we're being compared against the state average, which the state for this reporting period indicated was 271 tests. So there's still a delta there of about 680 tests per day that were below the state average. Because of that, the state then augments our case rate, artificially changes our case rate, as I mentioned before, from 16.1 to 17.9. So what this means for Kern County is that the state has indicated that Kern County is forced back into the most restrictive tier, that Tier 1 or the purple tier, effective on Tuesday. That is also something that has changed. Instead of giving businesses a 3-day period to prepare for those changes, they have now pushed that back to a 1-day period. So effective on Tuesday in Kern County, the state is indicating to us that church services would need to be conducted outdoor, that restaurants could no longer do indoor seating, that movie theaters and gyms could no longer operate indoor, and that retail facilities previously that could operate at 50% capacity had to revert back to 25% capacity. So Kern County is not alone. Unfortunately, there are many counties in California that are in a similar situation, and in fact there's now 41 counties that either were in the purple or moved into the purple with Kern County on Monday. The state is also making some further changes to their structure, their blueprint, or their tiered system. I mentioned the 1-day versus 3-day implementation period. They've also indicated that they are deploying their emergency brake provision within that document, and in such they are going to move counties to the more restrictive tier after failing the metrics for 1 week instead of 2 weeks. So that allows the state to move counties back into those more restrictive tiers quicker. In Kern County, that didn't have any applicability since we were already in week 2 of our of not meeting those red tier metrics. The state has also made mention that they are looking at increasing the wording, the encouragement for masking throughout the state. They've indicated to us that they are going to make changes in the industry sector guidance documents that reference masking. For example, in restaurants, they're going to be more specific, asking individuals to wear a mask more often and only taking it off when you're actually eating. So we expect those changes to come out soon. They've also made reference to other industry sector guidance documents that will be updated with this stronger masking language. They've also made mention that counties are now frozen in their current tiers, and our interpretation is even in the off chance that Kern County would improve within the next short period of time, we would not be able to move to that less restrictive tier until the governor has unfrozen counties, and he was supposedly going to do that either by region or by the state. There's also been issuance of a travel advisory with the upcoming holidays. This is just the concept of trying to stay within your community so that spread of COVID-19 is potentially limited. This is an advisory. They're asking anybody that is actually traveling into California to self-isolate for 14 days. And there was discussion about an advisory curfew, and we believe that might be released with some information today from the state. So what we are doing here in Kern County is we've been working hard at developing our canvassing approach and our outreach and testing approach in those 35 census tracts that the state has asked us to focus in on. That's the health equity metric. And again, the state has used an index called the Healthy Places Index. It's a socioeconomic health-related index that then attributes values to all the census tracts in Kern County. And the bottom 25% of those census tracts, they've asked us to group those together and ensure that they have lower testing positivity numbers. So to achieve that goal, this week we have deployed a team. It's the first phase of our team. They are going door to door in one of these first census tracts. We focused in on 2 census tracts in Delano this week. They're going door to door, providing information, handouts, door hangers, material about testing sites, the importance of testing, talking about wearing a mask and the importance of it, how to properly wear a mask. If somebody is not home, they're leaving the material on the door. We're also developing direct mailers. Today, more than 56,000 letters went out with this information to all 35 census tracts. And we're also using the Ready Kern system, the reverse 911 system. This is a system where people can enroll themselves, and then this system allows us to send out messages in large amounts. So we're focusing in on sending those Ready Kern messages out to those 35 census tracts. We do it in coordination with our canvassers and then with the subsequent testing. So for example, these last couple days we've been going door to door in Delano, and we have a testing site now that's set up for today. We're hopeful that the education, the door-to-door efforts, and the direct mailings eventually, and the Ready Kern messaging all drives people to get tested. Not only does that help to improve the health of our community, it then also meets the state's request that we drive down that testing positivity in those vulnerable census tracts. So this week was the first week of our boots on the ground effort. This team will be expanded, and we hope to have 40 to 50 different canvassers at any one day in the field making contact. And then finally, the state has been releasing a new therapeutic that has some benefits to shorten the duration or the severity of the symptoms of COVID-19. That has been deployed in a couple waves in Kern County, and We are working with the state finally in developing our vaccine distribution plan. This is a very thorough plan that involves quite a bit of effort working with local doctors and then developing the plan on distribution. We don't have dates yet, but we are inspired by the effectiveness that's been reported on the vaccine, and we think that may actually provide some significant relief to Kern County. With that, I'm going to turn it over to Ryan Alsop.
Good morning, everybody. It's difficult to come to the podium to appear before you to discuss the situation that we find ourselves in related to COVID-19. On any given week over the last 9 months, we've been dealing with this, and this morning is really no exception to that. Our Board of Supervisors and both Mr. Constantine and I find ourselves in the extremely difficult position of trying to lead our community through this extraordinary time we're in. And of course, this is why we're here, and it is a privilege, it's our privilege. But navigating through this epic mess that our country and our state finds itself in is a very difficult and daunting task. Both Mr. Constantine and I understand that any given week, when we are here speaking before you on these matters, our words, what we say, matters. We also realize that no matter what we say, there are those of you who will take issue and will disagree, and there are those that will embrace and agree. And even that seems to change on any given week, depending on the situation. With that said, I want to, up front, I want to thank the residents of Kern County and our community for the very hard work they're putting into this effort, all that they're doing at home and outside their home to make sure that they are helping manage and control the spread of the virus, everything they're doing to ensure the safety of themselves, their families, and their friends. Our community is doing a good job. I want to thank our business community for the past 9 months who have been whipsawed by varying rules and procedures and directives, who are struggling. I want to thank our business community for the effort that they're putting in to comply, to make sure that whether they're a retail business or a restaurant or anybody in between, making sure that their employees and their patrons are safe so that the spread of the virus is extremely limited. And just thank you very much for all the work and effort that you're putting in under very difficult circumstances. I want to thank our schools, the administrations at these schools, our teachers, for everything that you have done and everything that you will continue to do to have our children back in the classroom safely and responsibly. The work, your work right now, is the most important work being done in our community, if you ask me. Thank you to our healthcare community, obviously our hospitals, our hospital administrators, our nurses, our doctors, for all of your continued work over these past 9 months. Thank you to those people showing up, essential workers, first responders, certainly our own county staff showing up, continuing to do work on a daily basis under very, very difficult circumstances. This week, given increasing rates of infection all over the United States, we find ourselves, along with about 95% of the state's population, our own state's population, having to deal with increased restrictions on how we live and on our own local economic activity. We're all tired. We're all over having to deal with this hell of a mess that we're in. We are, in short, socially, emotionally, and financially overwhelmed, spent. Many of you, particularly our business community, are frustrated with the changing directives and orders of our state's governor, which are affecting your lives and your economy, your livelihoods. To be fair to the governor leading the state through this time, doing all you can to manage through this and manage the spread of this virus is a very tall order, particularly when there is no instruction manual for it, and with the future of the virus being uncertain. However, this frustration that you feel is real, and we understand it. You have every right to feel that the way that you do. And those of you who are at your end, you have every right to voice your dissatisfaction with the way things are being handled. It certainly does not help and only adds to your frustration and overall confusion when you see reports that the very state officials demanding and in fact ordering rigorous adherence to state-issued directives may not be adhering to those same directives and orders themselves. It also doesn't help when you go on TV or you go on the internet and you read 35 or 40 different stories or reports about COVID-19, and they all conflict with one another on data and facts and outcomes and suggestions, etc. This only adds to our confusion and the problems that we all have in dealing with this. Folks, this virus is here in our community. It continues to spread. It will continue to spread rapidly until an overwhelming majority of us contract it and/or we have a viable, effective, and safe vaccination made widely available. Staying vigilant, washing your hands, not touching your nose, eyes, or mouth every minute, staying away from others when you're sick, regularly cleaning frequently touched surfaces, distancing, wearing a mask when you're in large, unfamiliar, particularly unfamiliar groups of people, when you can't distance, and yes, keeping yourself and your family members in overall good health with a good diet, good sleep, good exercise. All of those things are time-tested standards in achieving good health and protecting yourself in any time from getting sick. This is the foundational bedrock method that we need to employ in this community to help slow the spread. If you're at an age, or if you have an underlying medical condition or several underlying medical conditions where you're at greatest risk of complications from COVID-19, you should be practicing these things with the utmost rigor, more so than all the rest of us. These are the practices that will slow this thing down. These practices will maintain adequate capacity in our medical institutions, which continues to be Kern County's top priority. These practices buy us time and help us perfect treatment options. These practices will help, at the end of the day, save lives. We can't let up. We can't let our guard down. We need to continue these practices with daily regularity. We thank you for what you've done. We thank you for what you will do. This is very, very important. With that said, our business community, our parents, and their children should not carry the full weight and burden of managing through this pandemic. Our local contact tracing shows no evidence that restaurants, gyms, churches, or schools are contributing to significant spread in our community, nor do we have any evidence that they are the catalyst to the surge in case rates we are experiencing now. Our local data indicates that this virus is being spread with regularity through private social gatherings and in situations where individuals are not practicing or are ignoring altogether the litany of best practice, public health practices that I just discussed. While the vast majority of us in Kern County are doing all we can, it just takes a very small fraction of us to blow it for everyone. In short, it is not the fault of those businesses who are going to great lengths to be safe, who have been following the rules for months and months. It is not the fault of our schools, who on a daily basis now are approaching our students' lives and their well-being safely and responsibly and with vigor. I believe that our restaurants, our gyms, our retail establishments, everyone in between, can operate safely and responsibly, adhering to state-issued public health protocols for very limited and measured indoor operations, just as they have been doing. I believe that it's possible for our places of worship to conduct services indoors in limited capacity, following strict state-issued guidance. Guidance that was specifically issued to assure the threat of transmission of this virus is extremely low. I believe that our children need to be in school as long as those schools are operating under strict public health protocols that ensure the safety of our kids and their teachers. And when the virus is detected, there are protocols in place to immediately and effectively deal with it. These measures can work, and they are working. Our schools are doing an outstanding job. But despite what I might believe as the CAO here, despite what our board members may believe, we have no control over the state or the decisions that they are making. We have no control over which businesses or activities they order shut down or closed or modified. We have no control over any orders, directives, or advisories that they make. The governor, as I've said before, numerous occasions, has tied millions of dollars in funding to counties, he's tied those millions of dollars to our compliance with his orders. And we're required to attest on a pretty regular basis to that compliance. Those businesses that are here locally that don't comply with the governor's recent orders this week may very well be subject to state action in some capacity. It's unclear to me how the state is going to approach this going forward, if differently from before. We, however, will continue to make businesses in our community aware of what the state is requiring of them. And we will do that proactively with rigor on a regular basis going forward. We'll also continue to be sharply focused on the things here locally that Kern County can control. These are things that Mr. Constantine spoke about earlier. These are things like testing, making sure we have ample capacity, making sure we have ample capacity in the areas of our community where it's needed most, making sure we are getting more and more people with each and every day going forward to get tested. We need to double our numbers. Our tracing, our contact tracing, doing a good job there. Economic relief and assistance, we've done a heck of a lot of that over the last 9 months. These are things that we will continue to do. And obviously strong public education. These are things locally that we have the greatest ability to control, but we also can control what we ask of our governor. And this morning, Governor, it's our hope and our request that you carefully consider the decisions that you're making related to COVID and the decisions that are impacting our community and our Kern County businesses and our residents going forward. We've been at this a long time. Please make data-driven decisions. We want to help. We want to support you. We want to be part of the team. We want to slow this thing down. We want to maintain capacity in our hospitals. However, repeatedly targeting our small businesses, whipsawing them with new directives and orders, particularly after they've spent time and money implementing your public health protocols, only drives them further away from complying. And you're losing them, Governor. Not just here in Kern County, but you're losing them all over the state. They are capable. Please, Governor, keep our children in school. They are there now, for the most part. There are some kids that are not back yet due to decisions by school boards. But thank you. Thank you for allowing our students to be back in the classroom. But, Governor, moving them back home only exacerbates our challenges managing through this. Our children are not learning at the same level from home. Mental health and social welfare are at stake for many of our kids here in Kern County, particularly here in Kern County. Give schools direction, give them guidance, and hold them accountable for meeting the moment. Hold them accountable. Regulate that. They are capable. Lastly, Thanksgiving is next week, and I'm not going to stand here and pretend that we have any control over what any of you do at home on your private property during the holiday. We want you to enjoy your holiday and enjoy Thanksgiving. You should all do that. However, we ask you to consider the fact that this virus is here, it's spreading, transmission is going up, not just here but everywhere. It's real. Those in your family that may be attending these gatherings who are predisposed to potential complications, they're at an age or they've got underlying medical conditions that may complicate things if they come down with this virus, requiring hospitalization, potentially even risking lives at the end of the day. Those people you need to take great care with. Those people that I'm talking about who are considering attending Thanksgiving gatherings, you may not want to go. Folks, we need to stay vigilant. We ask you to simply be smart and stay vigilant, but enjoy your holiday. We thank you very much in advance for everything that you're going to be doing, that we're all going to be doing together going forward through this very difficult time as we move through the holiday and into the end of this horrible year that we're in. And we appreciate you. So with that, we're going to get into questions. Megan Person is not here today, so I will be managing the Q&A. Remember, each news organization that's on the line, I'm going to go through, I'm going to call your organization out to no particular order. You are on mute. To unmute your phone, it's simply *6, I believe. And we will begin the Q&A now with Valley Public Radio.
Hi, thank you, Ryan. I was wondering, so about the motion that the county passed months ago at this point to spend a number of $1 million on bringing on traveling nurses. I was wondering if there's any of that funding left to bring on more, and also what are hospitals in the county, generally doing to sort of prepare for a possible surge?
Yeah, I'm going to answer the first part and ask Matt to answer the second part. But yes, our board, I think, smartly set aside $12 million in CARES Act funding to specifically support hospital capacity, really around staffing. Staffing is a critical function of maintaining bed capacity. In other words, we may have enough empty beds, but not enough staff, and certainly on the acute care side. And so that effort was meant to early on stake out a position in the traveling nurse marketplace early on, so that we were assured that we would have a pipeline of nurses if we needed it, and we wanted to make sure we were ahead of other counties. As you've probably read, there have been reports that people are struggling to contract for these kinds of services at this late stage in the game. So we are very happy with the actions we took. We have spent, I think, north of 1.3, 1.4 million so far on staffing. Again, we've set aside 12. So having that money there going forward in the weeks ahead is going to be critical because we know that case transmission and increased case rates does have direct correlation to hospital rates and hospitalizations. So we're very happy that we are prepared, we hope, to deal with that on the staffing side. And I'll let Matt talk about some of the other preparations.
Good morning. So as of November 16th, the hospitals are reporting to the state that they have 863 beds that are available. They're empty and they're ready to take patients if needed. That is a significant amount. It's higher than it's been in months. We have noticed a small decline in the last several weeks, but the hospitals remain available. We have 58 ICU beds that remain accessible also. So to answer your question specifically, they are prepared. They have access to the $12 million that's been set aside by the Board of Supervisors to bring on traveling nurses. We have the alternative care site that remains accessible. We need 48 hours notice, and we can have it completely set up and ready to take patients. We meet with the hospital CEOs routinely and talk about our surge plans and talk about resources that are needed. We talk about what the state could provide if needed. But the hospitals do this on a small scale on a daily basis. They are constantly trying to manage what patients are coming in and where the highest priority is. This is what they're good at. This does take more of a collective effort, and it is county-wide, but these are the experts, and they are ready. We, of course, are concerned about how high or what is the height of that surge, what is the peak, and the duration of the peak, because over time that could potentially impact our hospitals. You heard the governor say this week that on average there's about a 3-week delay from when cases start to peak and when we start to see our first hospitalized patients. In Kern County, on average, about 10% of our cases are hospitalized and about 3% require intensive care hospitalization. So I'm hopeful that that addresses your question.
Yes, indeed. Thank you.
Okay, thank you. Channel 29.
Hi, everyone. Good morning. Mr. Alsop, you had talked about, in terms of enforcement, that the state is watching some of our businesses closely. I know that obviously a lot of folks have a lot of sympathy for the really tough times that many of our businesses are currently enduring. In what way is the state watching? Are they actively sending teams down here like they have in the past? Are they relying on local folks to report businesses that might not be in compliance, or how is that actually happening?
Well, the first way it happens is when news organizations report that a particular business is not complying. The state has the governor's office has a vast array of staff in media relations and communications who scour news reports throughout the state on a daily basis with keywords, identifying obviously things related to COVID and everything else, and they see those, and I'm sure those get forwarded on to the appropriate personnel, whether it's a strike team or a particular regulatory agency. So that's the first way the governor finds out, and it's the easiest way. The second way is if we have a situation where we are interacting and engaging with anybody that may be operating outside state directives, and after several communications, those communications fail to produce any results. There is communication between public health officials at the local and state level so that everybody's on notice at any particular organization in the community that may be violating those things. So those are the two main ways. I would say the easiest way and the most immediate way is when your news organizations put out reports, and I've seen many. Those are seen and identified, and that's really the quickest way the state finds out.
Okay. So the county public health officials are at least in some communication with state health officials of some businesses if there's repeated non-compliance, but there's no formal, at this stage it's still just recommendations. The county's not formally enforcing anything. Is that correct, sir?
Our county continues to monitor the state's directives and orders and guidance. We continue to take those directives, orders, and guidance and communicate all of that out to our business community to make sure that they're aware of it, where they can find information related to guidance documents, rules, procedures. We communicate to make sure that they're aware of what the state is requiring of them. These are state orders. And we make sure that the businesses in our community understand what the state's requiring of them. We'll continue to do that going forward, and that's the position that we'll continue to take.
Got it. Thank you.
Channel 17.
Good morning.
Good morning.
So this has some overlap with the previous question from Channel 29 here, but my organization has covered some businesses, for instance, a local cafe that has basically admitted its lack of willingness to comply with guidelines. And so I know that public health is communicating from a county to a state level, but what exactly happens when you do find non-compliance? Is it just that communication between the two? And going off of that, has any action been taken against any non-compliant businesses?
I'm going to let Matt answer that question.
Good morning. So we do receive complaints or concerns from other businesses or the general public about businesses that they view are operating outside of the governor's order. What we have done from day one is we send out information to that affected business to provide additional information. At some times it's confusing, as Mr. Alsop has said. The rules and the guidelines have changed, but we send a letter out informing them that there is a concern that's been expressed and asking them to review the appropriate guidance document, and that we're obviously here to help try to interpret. But we take no further action than just that. As Mr. Alsop said, the state's strike team, enforcement strike team, remains active. We've had very little communication with them from the onset. They do send out weekly emails statewide, but we have had no direct contact with the strike team. Our job is to do everything we can to encourage people to comply, but it is the state order and for the state to enforce. Thank you.
Thank you.
Okay, Telemundo. KNZR. KUZZ. Bakersfield, California.
This is Sam with the Californian. I have sort of a two-part question. The first part goes with, we've sort of experienced 3 rises in the coronavirus pandemic since March, I guess, and I'm wondering, does this feel any different this time, and what is different about it? And my second question is sort of on the technical side. I thought the state released the new statistics, and they're sort of a week behind. So does that mean that the statistics we're seeing really begin 2 weeks ago up until Friday of a week, like last week? So really, the updates for the next Tuesday or Monday, they're sort of like, they've already happened. Does that make sense, what I've just said?
Yeah, I think so, Sam. We're going to ask, I think, Kim Hernandez to try and answer those questions for you.
Okay.
Hi, Sam. Good morning. As you have probably all noticed, this is what people are calling the third wave of COVID. Nationally, it is sort of the third increase in cases that we've seen across the country. Here in California, we were actually able to sort of keep it in only a single wave over that sort of summer month in July, and that's what we saw here in Kern County. So we're kind of in California into the second wave that we're going into. So we know that can be confusing for people, because when you listen to national news stories, it's talking about the third wave. In any given, regardless of what wave this is, what we see nationally is that, the daily case rate being reported by CDC is twice what it was in July. So there are a lot of concerns here in California that this surge of cases we're seeing now will continue to get worse. Statewide in California, we're around the same number of cases that we were seeing daily when we were at our peak in July, but we are still seeing them increase. And so hopefully that helps people understand of what we're likely to see in the next coming weeks and the concerns we have. In addition to growing case rates, we have difficulties going into winter months, which is what we always consider flu season and winter respiratory season, of being worried that, we're driven indoors by the weather, that we're in closer proximity to people during that time, as well as things like that tend to happen during this time of the year, like the gatherings around all the holidays that are, that have come and are going to continue to come, and we want to be careful about what's going on in our community. So when you were talking about the case rates that are coming out from the state, if you're talking about the numbers that are used to measure for the blueprint metrics, they do have a lag time on them. And so, because we know that cases that are being reported right now are from a few days ago when those specimens were collected. They have a set time frame so that they make sure that we have gotten results on all of the specimens that have been collected during that time frame, and then they look at those 7 days and average out that time. And then that 7 days moves from week to week. With the new blueprint, they are adjusting that so that they're looking closer in time because it used to be a 7-day lag, but now they're looking a little bit more real time because we're trying to anticipate the changes and the increases that are happening at a faster rate. Obviously for us here in Kern County, we watch this daily, and you guys can see it on our dashboard daily about the new cases that are being reported. If you are, following along, we saw a surge in July. We saw those cases decrease August and September. Now in October and November, we're seeing those cases go up again. And so we want to caution everybody to continue to do whatever they can to reduce transmission in our community and continue to do all of the recommended things to be safe and keep taking care of, and most importantly, the people who are most vulnerable. We all know somebody who is at high risk of severe COVID illness and potentially death, and we want to make sure we continue to protect those people as we face these oncoming cases. Thanks, Sam.
Okay, thank you.
El Popular. Kern Radio. Channel 23. Kern Soul. Mojave Desert News. And lastly, and I'll go back through the list real quick, but lastly, Mountain Enterprise. Marcy, I'm told that you're on the line.
Actually, this is Patrick Hedlund with the Mountain Enterprise. Can you hear me?
I can. Yes, ma'am.
Thank you. So we serve the Fraser Mountain region up on the Grapevine and to the west and east. And we, first of all, have been noting that when we had the mobile testing unit in this region, we are showing really high response rates. And even I was noticing your recent statistics from the fairgrounds testing. And I believe that we did here, when you were up here with your mobile unit most recently, as much as you folks were able to do in one of your days there in the city. So I do believe that you can help your objectives in terms of upping the statistics of tests and ours, which is an objective of keeping people informed and knowledgeable about what's happening in terms of our local community. I need to know, to be able to inform people, when do you plan next to send a mobile unit to the Fraser Mountain communities, Pine Mountain, Fraser Park? That's my first question. I do have a follow-up on that.
Yeah, so to answer the last part, to answer your question, I don't have that information. I don't know, to be quite honest with you. But that doesn't mean that we are not planning on getting a mobile unit back up there. We do recognize the contributions toward our testing rates, increasing those, made by the Fraser Park, the mountain communities that you're talking about. The efficacy, testing efficacy there has been high, and it has been appreciated. And so to your point, we agree, and we will be coming back up there. I just don't have a date for you, ma'am, but when we do, we'll certainly reach out to you, being the news source or a major news source up there, and hopefully we can work with you to get the word out so that we can get as many people to that site and tested as possible.
Thank you. I really appreciate that. And it is true, we really do continuously keep people apprised of the opportunities and are really pushing for people to participate. We have had an increase in cases here, and we also know that the statistics that you reflect in the county are not necessarily consistent with what we know here in terms of just people that are not showing up in your stats. But a lot of our people have to go to places like in Los Angeles in order to get their tests. And we do have a number of questions as to whether those stats, on what regularity they get swept into local residents' statistics. But my other question that is of great concern to us as well is that every single individual that I interview on any story in this area, I asked if any of them have been called by a contact tracer. And we recently had a situation where an individual was working at the polls, and from Tuesday to Friday began to have symptoms, and then on Monday, which was a full 6 days later, finally got a positive test return. And that individual made numerous calls by the time she started to feel better to people that person was aware of being in contact with, and to the county election board, etc. But no members of the county contact tracing team got in touch here with anybody. That's an isolated case, but I have numerous of those in which our community has gathered around to be supportive to people who have come down with COVID. And when I ask, who has been called by the county contact tracers, 0. So could you address that? What does Zoom need so that
we will.
You can help us?
I'm going to ask Public Health to try and answer that question.
Thank you.
Good morning. We are very interested to get more details from you, so I think we will be reaching out to see if we can identify if there are any gaps. We do have a large number of people who are working in case investigation and contact tracing every day, and they are doing their best to reach out to people. Our normal process is to attempt at least 2 contacts, as well as mailing information to people who are identified as cases in our community, so that we can reach out to them, obtain important public health information, provide guidance and answer questions, as well as to get contact information of close contacts. Whenever that information about close contacts is provided to us, those people are also contacted by us at Public Health in order to let them know that they may have been exposed to someone with COVID-19 and that they should quarantine for 14 days until 14 days after that last exposure. So we're very interested to hear about what's going on, particularly since you mentioned that a number of people in your community are getting tested in Los Angeles County. We want to make sure that we are getting those reports quickly from Los Angeles County if they are happening to be routed in the wrong direction. Residents of Kern County should be reported to Public Health, but we want to make sure that they aren't missing anywhere and that we are still able to reach out to everybody in all parts of our community. So we're glad for the feedback. We will be looking into it, but we want to remind people that answering the call from Public Health is really important. We seek to be a resource to answer questions, to give guidance, to provide support for people who have needs during the time while they are potentially infectious and need to isolate at home. We do the same for our close contacts, where we are letting them know that they need to quarantine, and trying to identify if there are any other resources we can provide for them to make quarantining as easy as possible. keep a lookout. We'll be reaching out to find out if you're able to provide us with more details so we can look into these situations more closely. But we encourage people to continue to do their best to do the right thing, to isolate if you have symptoms or if you test positive, to quarantine if you're notified that you may be a close contact during that quarantine period. We need you to stay home. We need you to watch carefully for symptoms. We do recommend that people who are quarantining get tested for COVID 5 to 7 days after their last exposure, so that we can identify whether or not you are testing positive and whether or not you need to isolate for a longer period of time. So we encourage all of those things to continue to happen. We welcome calls and questions at the health department. If you've tested positive and no one has reached out to you, please contact us. We want to hear from you. Chances are we've been trying to reach you. We may have a mistyped phone number. There may be an old number for you on file with your healthcare provider's office, and we want to make contact with everybody in our community so we can make sure the best information is out there. Thank you.
What number would you want them to call?
So the main number to public health is 661-321-3000.
Thank you.
Thank you. And Kim just demonstrated the difficulty and challenges that our public health team faces every day in doing the work that they do in contact tracing. It's not as easy as it sounds. It is a laborious undertaking and requires a great deal of effort on their part. So I want to thank Public Health for everything they're doing in that area. So I'm going to go back. I'm going to start at the top of the list. I'm going to go through real quick. Please be frosty on the *6 right up front because we want to move through this really quick. We've been at this about an hour now. Valley Public Radio. Channel 29.
Hi, yes, thank you. I was wondering when it comes to
Hey guys, quick question.
COVID-19.
I'm sorry, who?
Oh.
Is this Valley Public Radio?
Yes, I am. Yeah,
Okay,
Carrie Fine here.
Okay, go ahead, ma'am.
Sure, yeah. So I was wondering when it comes to COVID-19 long haulers, I know that there aren't, this is also new, but I just wonder if there are any resources or specific clinics or even just providers at certain hospitals that are set up to see long haulers, or if there are any sort of places where you're funneling people who seem to be suffering these really long consequences of the disease.
Kim, we'll have Kim answer that question for you.
Hi, Carrie. It's a great question. CDC has mentioned and continues to look into sort of this long-term sequelae, these long-term effects that some people are facing after their COVID-19 infection. As far as we know, we don't have anything specific set up in Kern County with a specific provider to refer people to. In general, we always encourage people to continue to follow up with their regular healthcare provider. If their regular healthcare provider feels that they need additional follow-up, chances are they will be referred to an infectious disease doctor to continue that follow-up. But this is something that we're continuing to learn more about people who have sort of long-term effects of COVID after they've recovered from their original illness, and CDC as well as the state continues to look into that very closely. So if you are affected in that way, we'd encourage you to follow up with your healthcare provider and then to get referrals as appropriate.
Okay, thank you.
You doing okay over there, ESL interpreter?
I'm all right, thank you.
Okay, we appreciate you. Channel 29. Okay, moving on.
Hey guys, just really quick so we have it. We alluded to we discussed, we didn't allude to the Thanksgiving recommendations. I know you say you can't obviously tell people what to do when they're on private home. What about folks who have family out of town, maybe in LA County or whatever? Are we formally recommending that they just make alternative plans, or what's the county's formal recommendation there?
You're talking about recommendations to residents about who they're inviting, or recommendations on people that are...
So if I have family in LA County and I got invited to one of their Thanksgiving, does the county recommend I don't go?
To LA County?
Yes, or any other county.
What we recommend, sir, is that you be smart, vigilant, wash your hands, distance, wear a mask when you can't distance and you can't avoid being around large groups of people that you haven't spent any time with. That's what we recommend.
Okay, thank you.
Channel 17. Telemundo. KNZR. KUZZ. Bakersfield, California. El Popular. Kern Radio. Channel 23.
Wondering, my question for Kim, we saw reports this week saying we have vaccines that are looking to be as much as 90 to 95% effective. If the FDA authorizes the vaccine, Pfizer has said that it could have up to 50 million doses available by the end of the year and up to 1.3 billion by the end of next year. Given those numbers, can you talk about how long you believe it might take before a vaccine could make a real dent in the damage that the virus is doing to our community?
That is a great question, and it's kind of everybody's million-dollar question right now about, how will vaccine help us? And we have heard, similarly to you, that it is expected to be reviewed and hopefully authorized soon. We expect it to move throughout the United States and into California and here in Kern County quickly, and that we have been working with our local community members to get vaccine out as quickly as possible. I'm trying to think of a recent study that was looking at basically how much immunity needs to be in the community in order to really stop the transmission of COVID. And I'm trying to recall off the top of my head, but it was somewhere around 80%, where we needed 80% to no longer be susceptible to COVID in order to really have a chance at completely disrupting transmission. Currently, our role is trying to limit the spread and to reduce transmission as much as possible. We're trying to protect our healthcare infrastructure as well as all of the individual people in our community. But we know that vaccine will play a role in reducing the susceptible population in our community. There are a lot of challenges around particularly the Pfizer vaccine, but we've been working through that with our state and federal partners to prepare to receive that vaccine in our community, to prepare to get it out to the priority populations that are being identified, and to continue to bolster our healthcare system as well as our entire community. So there's no special date. Unfortunately, there's a lot of things involved, including, how well we can reduce transmission during the time before vaccine gets here, our ability to continue to reduce transmission while vaccine is coming out. They don't expect that we will have enough vaccine right away to vaccinate everybody in the community because it is coming out as it's being manufactured in as large of chunks as possible. We do expect to get it to our community quickly, and that will help reduce spread in our community. So unfortunately, there's no magic number, there's no magic date, but we hope it's soon. We hope that we can continue to do what we can to drive down transmission so that we can get to the point where we are truly ready to interrupt transmission completely and stop the transmission of COVID in our community.
Thank you.
Okay, thank you for that question. So we're just finishing the list. Kern Soul. Mojave Desert News. Go ahead, Kern Soul. Whoever that was, go ahead, please.
Hello, can you hear me?
Yeah, is this Kern Soul?
Yes, sorry. So our question was, as the flu season nears, how is Kern County planning to ensure that residents receive them? And do we have any current statistics on how many people have gotten their flu shot?
Flu shots is the question. Percentage of people to date that have gotten flu shots is your question?
Yes.
Okay. Kim, do you know that?
Good morning. Another great question. Unfortunately, that's not something that the Public Health Department readily has access to. Obviously, we know that we've had flu clinics that Public Health has offered, and we can track how many people have been vaccinated through those, but we don't get information necessarily about all of the pharmacies that are vaccinating, all of the healthcare providers that are vaccinating, so we don't actually have an official number. We continue to encourage people to be vaccinated against flu. We know that this is a time of year where flu tends to circulate. We tend to see it really start to pick up right as we hit the holidays here in Kern County, so it's never too late to get your flu shot. We encourage people to do that, and that, we talked about several weeks ago where people were really concerned about what they call the twin-demic of flu and COVID circulating at the same time, and what that might mean for individuals who are co-infected with both. It has been documented here in California that people have been infected with both flu and COVID, and so knowing that we do have the flu vaccine available, it's readily available in our community, we encourage everybody to be vaccinated for flu.
Understood. Thank you.
At the risk of leaving anybody out, I know that the Latino Task Force, who's working with public health to do testing in certain areas of our community, they're partnered with Dignity, I believe Dignity Health, and are offering at several of these sites both a COVID test and a flu shot for people who are going to get tested at those sites. All of our testing sites could be accessed, easy to read. You can type in your address and find a testing place nearest you by going to kerncounty.com. It's right there on our front page. With that, Mojave Desert News. And lastly, Mountain Enterprise. Okay, ladies and gentlemen, thank you very much. Happy